Hello, guys. This video is about the injuries in volleyball at the arm part. Arms injury during volleyball activity is divided into three parts, which are finger injuries, elbow injuries, and shoulder injuries. Injuries to the hands can occur due to body factor, health, and movement in activities. Generally, how it can be prevented. By regular stretching, it can increase range of motion and decreases muscle stiffness. Fingers. Fingers are vulnerable to injury during volleyball game due to some activities such as blocking, setting, and digging. Three common finger injuries are dislocations, fractures, and tendon and ligament tears. If you are unable to bend the finger, consultation with your sports medicine professional or athletic trainer is important. Treatment can vary significantly depending on the injury. How can injury be prevented? Volleyball injuries can be prevented by following proper training guidelines, tips and many other several ways. Finger dislocation. Affect the finger joint or knuckle. A dislocation occurs when a bone is pushed or pulled out of alignment from its joint by directional impacts. Causes of finger dislocation. Direct impact to a single finger. Volleyball hitting a single finger during bump, set, spike or serve. Prevention. Going to physical therapy. Stability exercises are required to retain mobility, stability and strength, RICE. Finger fracture. Affect the bone. Broken finger bone. In a fracture, the phalanx will break. Causes of finger fracture. A direct impact to a fingertip from another body part or the ball until it reaches the breaking point. Prevention. Get to doctor for realignment. Wear a finger splint. Tape fractured finger to adjacent finger. Next is finger ligament or tendon tears. Affect the finger ligament or tendon. Sprains and finger jams are the stretching and tearing of the ligament. Causes of finger ligament or tendon tears. Using finger to break a fall in any direction. Jam finger from any direction, impact at the tip or against the joint from the ball or any body part. Prevention. Rest. Use ice. Compress and elevate. Minimize usage and movement during healing. Tendon. The inability to extend the joint of finger without assistance. The extensor tendon running along the back of the finger, is torn away from the tip of the finger. Causes of tendon. Stubbing or striking the fingertip, jamming causing it to bend backwards. Prevention. You must wear a splint and keep the finger straight at all times. This is the second injury for the arm part. The elbow injury. There are three types of elbow injuries, which are elbow bursitis, elbow tendonitis, and elbow sprains. So, how do we prevent it? To prevent elbow injuries, compression sleeves and elbow straps or braces can be used. Firstly, the causes of elbow bursitis are due to trauma, falling on the elbow, and hitting the elbow on hard surface. Secondly, the causes of elbow tendonitis are inflammation of the tendon that leads to the pain around the outside of the elbow. And lastly, the causes of elbow sprains are the arm is bent or twisted quickly or forcibly. It can also happen due to overload on ligaments, regular movement. How to prevent elbow injury? Firstly, a player can wear a compression sleeve, because it is functional to improve performance and recovery. And then, the player can also wear an elbow strap or braces. This will support and relieve tendon pain, and also help to stabilize your joint. Shoulder. The overhead motions such as serving, spiking, and blocking can place sudden and heavy strain on a number of structures around the shoulder joint. The most common shoulder injuries in volleyball players include internal impingement and slap. Shoulder internal impingement. Causes. Extensive overuse of the arm. Improper techniques when serving or spiking the ball. Prevention. Proper training program. Use proper techniques while playing. Slap tears, superior labrum anterior and posterior. Causes. Shoulder dislocation. Excessive overhead movement or force. Repetitive use of the shoulder. Prevention. Adequate time for rest and recovery. Participate in regular training program, which includes stretching and strengthening exercise. Remember, training can improve your technique in volleyball. A hard practice makes an easy game. That's all from us. Thank you.